It's the patient who went to her doctor complaining of what seemed to be inappropriate weight gain. She was gaining weight, but in particular in her stomach, and it seemed unusual to her. She also felt a little bit bloated and a little bit different, and so she talked to her doctor. But her doctor said, you know, you just need to exercise more. You just need to watch what you're eating more, and you need to lose weight. Well, that patient ended up having an ovarian tumor. That's why her stomach was getting larger, but it was dismissed as, oh, you're just overweight. You just need to exercise. It's that patient that came into her doctor complaining of joint swelling and pain that would sort of come and go over a period of time, and other minor complaints that she'd had, some fatigue, this and that. And the doctor said, oh, you're just probably stressed out, or, oh, you're probably just overworking your joints or overworking your activity levels. Just back off a little bit. And it turns out for that patient that she ends up having lupus. That was the cause of the joint swelling, the joint pains, and the fatigue. It's that patient that comes in with palpitations, feeling like his heart is beating out of his chest at times, feeling like he can't catch his breath, that something is going on with his heart. Never felt like that before. And the doctor says, well, you've been under a lot of stress lately. It's probably your job. It is very stressful, or it's probably a little bit of anxiety or things that are going on. Make sure you sleep enough, you relax. Think about your stress levels. When in actuality, it turns out to be a heart issue once he actually gets to a cardiologist. What I'm describing are examples of what some people are calling medical gaslighting. This is the idea that a patient comes into a doctor with symptoms or concerns, and instead of the doctor taking it seriously and working it up, the doctor actually inappropriately dismisses the patient's symptoms as minor, not a big deal, or as primarily psychological. It's all in your head, or, oh, you're just a little too stressed out. That is what we're talking about, medical gaslighting, this idea that doctors or healthcare providers are inappropriately dismissing symptoms, calling them, well, it's not much at all, or it's all in your head. Guys, this happens more than you might think, more than it should. And it's something we really, really, really got to talk about. I can't tell you, I'm a family doctor. You guys know this. I can't tell you how many times patients have come to me saying that in their experience being a human, being a person, having a doctor, they've felt like at some point their symptoms have been dismissed. And what's interesting about this is women are more likely to have symptoms dismissed or diminished. Also, people of color as well are more likely to have symptoms dismissed or overlooked, etc., not properly worked up. But the truth of the matter is it can happen to anyone, and it does happen. This is a real issue because as displayed by the examples I gave, when people are medically gaslighted, which means when their symptoms are dismissed, things are missed. Real medical concerns, real medical issues, real medical conditions, anywhere from heart conditions to cancer to lupus to other things are actually missed, and the patient ends up suffering because they don't actually have a proper diagnosis. Not only that, but the patient is left to believe that there's actually something wrong with them. Like maybe they brought this on themselves, right? Oh, I'm just overdoing it. Or I'm gaining too much weight. I need to get a hold of my weight. Or, oh, why am I so stressed out? Patients may end up blaming themselves. Has this happened to you? I want to know, write in the comments. If medical gaslighting has ever happened to you, tell me what's happened. Tell me what experiences you have. And I always ask for folks to write in the comments because I know that what you write ultimately helps other people who are reading these comments. And one thing I find as a family physician is that sometimes medical gaslighting can happen with any condition. But I often see it in particular with conditions that sometimes tend to be poorly understood by doctors or not frequently encountered. Sometimes rheumatological conditions, lupus, rheumatoid arthritis, etc. But things like fibromyalgia, chronic fatigue, other conditions. But those aren't the only conditions it happens to. This is the thing. Statistics actually have told us that women, and I mentioned women and people of color, tend to be victims of medical gaslighting, perhaps at higher proportions than others. Women have longer times to diagnoses for things like cancers, heart diseases, etc. They're less likely to be given pain meds when they need them and should have them compared to men. People of color tend to be treated more poorly, meaning they receive less adequate health care. They receive inferior health care more often and are often, as I mentioned, given poor quality of care, amongst other things. This is just a very quick snippet. Once again, medical gaslighting can happen to anyone, male, female, and of any color, race, or creed. But the idea is that, guys, this is wrong. This is wrong. And as a physician, I'm going to place the blame squarely on my colleagues, myself and my colleagues. You may say, well, why do doctors and healthcare providers do this? Well, there's probably many reasons. And it's not that all physicians or healthcare providers mean any harm. Some doctors may not simply know the answer to what your problem is. They may not simply know what's wrong, and they may respond in a way that sort of medically gaslights instead of looking into it. But it may be that they don't know. It may be that they're lazy. I'm just going to call it. Maybe they just don't have any interest or don't have the desire to work it up or figure it out. Maybe they have bias and discrimination, racism, bias, racism, discrimination. That affects everybody, to be honest with you. And even doctors suffer with these things, unfortunately, but it is very true. It could be that your doctor has a bias that is wrong and is acting out on that. There are also other issues. Doctors, quite honestly, and I know this from experience, we're not given a lot of time in the office with patients. We're not given enough time. Sometimes we have too many patients to see. Now, I don't think that that's a fair excuse for dismissing anyone's concerns, but I do want to mention that there's a range of reasons why some healthcare providers might say that they responded to a patient's complaints with X, Y, Z. I'll be honest, I don't think that this is excusable at all. I don't think that there's any excusable reason for this. I believe that if a patient comes in with an issue, we as healthcare providers need to treat that issue seriously and look into it appropriately, regardless of what we think about it. Obviously, our medical decision-making needs to play a role in that, but aside from any bias, etc. But that's in an ideal world, and we don't live in an ideal world, do we? And that's why I'm also going to talk about the other side, the patient side, is because, doctors and healthcare providers, this is our wake-up call, guys. We have to stop this, okay? And the idea of dismissing a patient because you don't know or don't want to know or don't feel like it or don't have enough time or don't think this patient is really telling the truth or whatever issue you have is really wrong and needs to go out the window. But let me give you, as patients, a few items to keep in mind that might be helpful, okay? It is not your fault should this happen to you, and it likely has happened to you because it happens a lot. It's not your fault, and you didn't do anything wrong. And the suggestions I'm telling you are not to tell you this as though you have the power to impact how a doctor treats you, because ultimately you don't necessarily. But some things that might be helpful is, number one, reiterating how whatever symptoms are going on in your life are impacting your health. Reiterating to the doctor that this does not seem normal to you. Sometimes it may be helpful to say, look, I know my body and I've lived, all these years and nothing like this has ever happened. It can also be very helpful to let us know how concerned you are. Doc, I'm really, really worried about this. Also, it can be helpful to, and this is what I say, and again, I'm saying all these things not to say that you have the power to change your doctor's response and, oh, if only you had done it this way, you wouldn't have been dismissed. That's not the case. It's not your fault. Okay, this is not about you, in my opinion. It's about the doctors. But since we're talking about this, a few other things that just might help you as you're communicating your symptoms to physicians, etc. Sometimes keeping a timeline is very, very helpful. A timeline of symptoms. When exactly they started, got worse. What made it better? What made it worse? When you ate this, it does this. When you eat this, it does this. When you don't eat, any of those things and any details can actually be helpful for us. Okay, but this is the thing. The bottom line is, if you have a doctor that is dismissing you, as a family doctor, I'm saying this quite personally and genuinely, I just want you to find another doctor. I do. I want you to find someone who you don't have to coerce or sort of trick or entice into taking care of you the way you deserve to be taken care of. You deserve to be heard, and heard the first time, okay? And your questions and concerns deserve to be addressed as well. And if you don't feel like this is happening, you deserve a better doctor for you. You deserve to find someone else, okay? This is ultimately what I think is important. I think the other thing too is that I've also heard situations where people have felt dismissed by their doctors. Every now and then I'll see reviews of doctors online. I'll take a look at my own. They're always across the board, right? Because, people write a range of things. But the truth of the matter is I'll read them every now and then. And I was reading I don't know how I found this, but it was a review that one patient wrote of a doctor, and she said that she was not happy with X, Y, or Z, and then she actually wrote the doctor a letter and told the doctor how she felt after the office visit, and the doctor called her and had a heart-to-heart conversation with her, and was able to see the patient's side and brought her back in, and they were able to repair the relationship and go on to have a very fruitful doctor-patient relationship. I'll also say that even though I don't condone or dismiss or make excuses for any of this behavior by doctors, sometimes doctors simply don't know what they're doing. Meaning, what I mean by this is they may not realize what they're doing. And sometimes it can be very helpful for a patient to say, hey, look, when you said this, it made me feel like this. Or when you said it this way, it makes me feel this way. Now, I'm not at all saying that it's your job to rehabilitate doctors and to train them how to be doctors. But just understand that feedback can be very helpful and it can be very useful. Even if you don't see that doctor ever again, the hope might be that they learn to be different for other people and other patients down the line. Those are just a few suggestions, guys. There's probably many, many more. And I actually want to know from your standpoint, what thoughts or suggestions do you have on both sides? What suggestions do you have for healthcare providers? And what suggestions do you actually have for patients like yourself who are navigating this world? Okay. The bottom line is, if you have symptoms or concerns, don't let them go without being addressed. And if you don't feel like they're properly being addressed by a doctor, you have every right, and in fact, I encourage you to go find another. Remember, you deserve the best, and don't ever let anyone make you or let you feel as though you don't, because you do. Guys, I'm Dr. Jen Caudle. Let me know what you think in the comments. For those of you watching on Facebook, please like and follow my page. Thank you for sending stars. For those of you who are watching on YouTube, please subscribe to my channel and click the little bell for updates. Also, I have subscription groups. Consider joining my Dr. Jen Superstars on Facebook and my subscription groups on YouTube. Guys, I'm Dr. Jen. I'll see you soon.